As with any other profession, there are certain accepted standards when it comes to patient care. Dental malpractice happens when these standards are not met and a dental professional's negligence causes harm or death to a patient. What can you do to protect yourself, your practice, and your clients in the event of dental malpractice? Keep watching to find out. A malpractice example. Let's talk about a more concrete example. Patrick goes to his dentist because of a toothache that has been bothering him despite him taking pain relievers. When Dr. Smith explains to Patrick that the tooth needs to be extracted, Patrick agrees without any question because he trusts his dentist's judgment and recommendation. After a successful procedure, Dr. Smith prescribes medicine to Patrick for the pain and to avoid infection. But a few minutes after Patrick takes the medicine, he starts to have difficulty breathing and turns out to be allergic to the prescribed medicine. What's wrong in this scenario? It is actually standard practice for a health professional to confirm if a patient is allergic to anything prior to prescribing any medication. It is part of due diligence that they ask questions to find out if any procedure or medication might pose potential health issues for their patients. For instance, if they are going to inject the patient with a drug that causes an increase in heart rate, then one would expect the health professional to ask if the patient is hypertensive or is under any medication for hypertension. But what if Dr. Smith did ask the relevant questions, but Patrick was not aware of any allergies? Obviously, whatever happens to Patrick isn't going to be Dr. Smith's fault. But it doesn't mean Patrick cannot decide to file a malpractice lawsuit against Dr. Smith anyway. Now, the question is, as a dental health practitioner, how does one get protection for potential costs brought about by a dental malpractice claim? Dental malpractice insurance. A dental malpractice insurance coverage helps protect a dental health practitioner from the potential cost of a dental malpractice claim. Whether the accusation is legitimate or not, this protection covers not just physical harm but also emotional stress and property damage. Some common reasons for patients to file a malpractice lawsuit against a dental health professional are complications from bridges and crowns, infections, death resulting from negligence, injuries from a root canal procedure, and more. Types of insurance. There are two basic types of malpractice insurance: claims made and occurrence. Occurrence policies will cover claims for incidents that happen while the policies are in effect, regardless of whether a claim is made while a policy is in place or whether it has lapsed. The important detail here is that the incident or malpractice happens while the occurrence policy is in place. On the other hand, claims made policies are a bit more complicated. For these policies to cover malpractice claims, the following should be true, and never one without the other. The policy was in effect when the incident happened, and the policy is still in effect when the lawsuit is filed. Although having occurrence insurance would obviously be the better choice, it is important to note that claims made insurance costs less, even with a tail coverage purchased. At the end of the day, the two most important things to consider before choosing between these two types of dental malpractice insurance are that your choice gives you peace of mind, and paying for the policy doesn't break the bank. If you have any questions, visit our site today. And if you enjoyed this video, be sure to like, comment, and subscribe.